Welcome, everyone, to our 2025 Self-Direction Virtual Conference Series. My name is Ines Rosas. I am a senior consultant at Applied Self-Direction. For my visual description, I am Latina. I have long, dark brown curly hair, and I am wearing glasses. Today, I'm wearing a dark blue shirt. And thank you again for joining us for the sixth session in our conference series, Proactive Program Integrity Within Self-Direction. We have an amazing group of panelists for you today. I'm going to run through a few housekeeping things before we begin. So due to the volume of the attendees, participant microphones have been muted and will remain muted. There is a toolbar at the bottom of the Zoom window with a few options you can use throughout the webinar. There is a React button where you can submit some reactions or emojis throughout the presentation. You can also submit questions and comments at any time during the session by using the Q&A button in the same toolbar at the bottom of your Zoom window. We have time reserved at the end of the session for your questions, and we will try to address as many of your questions as possible at the end of the session. Closed captions and translation are available for the presentation. You can access those closed captions by clicking on the CC button or choosing Show Captions. This session is also being recorded and will be available on our website along with the slides. The month of April is sponsored by PPL. Thank you very much to them, and thank you to all our sponsors. We'd love to know who is in attendance today, so take a moment to fill out our first poll question. Let me launch it first. There, everyone should see, hopefully be able to access it. We just want to know how you describe your role within self-direction, and I'll give some time to get some answers. I'll share the results, but so far it looks like the majority right now. We got 30. Ooh, yeah, it's moving quickly. 34% FMS entities, 32% state staff, and then our next biggest group is family or friend of a self-directing participant. That is awesome. Thank you for getting your answers in so quickly. I'll share the results with everyone else too. Nice, yeah, and it looks like our biggest group are FMS entities, state staff, and then family and friends. Thank you for joining us. I will now turn things over to Alyssa Denton to get us started. She is the Senior Regional Director at PPL.
Good afternoon, and thank you for the opportunity to speak with you today about a topic that lies at the very heart of the sustainability and trustworthiness of our programs, program integrity, and our ongoing efforts to combat fraud, waste, and abuse. As Ines said, I'm Alyssa Denton. I'm the Senior Regional Director at PPL, and I'll be moderating this presentation. Please welcome our panelists as they introduce themselves.
Oh, hi, good afternoon, everyone. My name is Becky Thomas. I'm noted as Rebecca, but that's my in trouble name, so I go by Becky Thomas. I am the director of the Office of Consumer Directed Services with New Jersey's Division of Medical Assistance and Health Services, also known as Medicaid. Just a little bit of my background. I joined the division 12 years ago, and I found my way to HCBS services by supporting our MLTSS implementation in July of 2014. From that experience, I learned more and more about our self-directed program. And in 2018, the program moved to my division here at the DMOS, and it has been my honor to serve our self-directed community ever since. So thanks for having me. I appreciate it.
And good afternoon, everybody. I am Tammy Rogers. I am the Assistant Director of DHS and here in Arkansas. So I'm over the Division of Aging and Adult Behavioral Health Services, but I'm primarily over self-direction and personal care through Arkansas. And I have been with DHS. I'm coming up on 18 years, and I've learned a whole bunch in that time. Thanks.
Thank you. Next slide. When we talk about program integrity, we're talking about more than just compliance. We're talking about protecting the integrity of taxpayer dollars, safeguarding the services that vulnerable populations rely on, and ensuring that every dollar reaches its intended purpose, supporting and protecting people. Program integrity refers to the measures taken by government agencies to ensure that taxpayer dollars are spent appropriately, effectively, while preventing fraud, waste, and abuse. Fraud, waste, and abuse definitions come from federal regulations, 42 CFR, and may seem like interchangeable terms, but they are very different and they require tailored strategies. Fraud is intentional deception. It's billing for services that were never provided, falsifying records, or misrepresenting provider credentials. Waste involves overuse or misuse of resources, even when not done with malicious intent. And abuse refers to practices that are inconsistent with sound fiscal and medical practices, like providing unnecessary services or charging excessive fees. And each one of these chips away at our ability to deliver quality services. And when left unchecked, they erode public trust, divert resources from people in need, and drive up the cost of care and supports. Program integrity is not about bureaucracy, it's about accountability and stewardship. In Medicaid, for example, where every dollar matters, integrity programs help identify suspicious patterns, prevent improper payments, and recover misspent funds. In the long-term services and support space, this means ensuring that people with disabilities and older adults get the care they need while holding bad actors accountable. But it's also about building systems that prevent fraud, waste, and abuse before it starts. Our panelists are going to share how they are creating smart policies, leveraging data analytics, and investing in workforce training. Next slide. Can you share some background for both of the cash and counseling legacy states of New Jersey and Arkansas? Oh, you're on mute.
Sorry about that. So New Jersey and Arkansas, along with Florida, were three of the first states that participated in the cash and counseling demonstration and evaluation. So from that experience, both New Jersey and Arkansas were able to implement the CMS self-direction waiver. The year's a 1915C. And then by 2022, CMS added the 1915J self-directing authority in 2007. Next slide, please. So for New Jersey, one of the history from the implementation of the 1915J in 2008, CMS approved our state plan amendment to add cash and counseling for self-directing personal care services, and our program is referred to as the Personal Preference Program, or PPP. PPP has been serving New Jersey family care and Medicaid members for over 23 years. Tammy, would you like to share some about Arkansas?
Oh, thank you. And in Arkansas, in 2007, CMS requested that we go ahead and submit a 1915J to replace the 1115 demonstration for self-directing. And I think at that point too, it was called cash and counseling. So we did submit that. And now we are also known as the Independent Choices Program here in Arkansas. And we have been serving self-directed clients in Arkansas for over 24 years.
Next slide. Can you share opportunities found for proactive program integrity?
Absolutely. So with these years of experience, we've had an opportunity to gather and learn from lessons learned, develop best practices. And through that, we identified three key elements here of program integrity from a proactive lens. We wanted to review our identified challenges that we've experienced, reconsider our solutions, and most importantly, innovate self-delivery with our community members, our advocacy partners, health plans, and our fiscal intermediaries. And through this experience, both New Jersey and Arkansas we've developed best practices that guides our approach to how we support our members in the self-direction world, that the folks that we serve right now, but also the folks that we will be serving in the future. Next slide.
Thank you. And what have you clocked as lessons learned along the way?
That's a great question. And here we've shown 3. So let's talk through those really quickly because they all come from learning from the people we serve. First and foremost, don't presume that you know what your participants or their caregivers want or need. If you don't know, ask. Our community voice has always been an integral part of the growth and improvement of our program. From the PPP point of view, from New Jersey, we've added a quarterly partners meeting where we get together with our community to talk through current items, current policy, and how the program is moving. We also include our community members when we're reviewing PPP member-facing communications. Who knows better how to communicate than the folks that we communicate with? And Arkansas added a quarterly advisory council, again, to open the door and get everyone at the table. And for our third, this is a really key point, self-direction programs carry a fraud, waste, and abuse narrative where it's important to note that every service in Medicaid, there will be times where there is fraud, waste, and abuse. It's not specific to the self-directed opportunity. I want to be really clear in that lesson that we are always advocating and understanding that really important point. Did you want to add anything?
I do actually. You know, I've learned many, many lessons, and I do want to say this because looking back all these years, I think one of the things is we didn't always reach out, and I will encourage you all to network, whether it's about quality assurance, fraud, practices, you know, start networking and asking questions with individuals about how they're doing things. If you don't have to reinvent the wheel or a process, then I highly recommend that you don't, because of course, unless you want to go through some of the painful growing, which you will, but you know, let's minimize the pain as much as possible and just start building a directory of individuals you can go to talk to about how are you handling this or how are you handling this fraud. So that's one of the big things early on. I probably wish that we would have done a lot more aggressively, but lessons learned. Thanks. Next. Okay. And we want to talk about who is responsible for program integrity. And obviously it is all of us. This is kind of a holistic view of who's responsible. So you can see, you know, the payers, managed care, FFS, fiscal intermediary, FI vendors, Office of Inspector General, Medicaid Fraud Division, MFD, participants, and workers. And we are all responsible. Next slide.
So let's talk about program integrity and an approach, specifically if we look at a proactive focus. So here are 5 different program integrity elements. So let's do a quick walkthrough to talk through how each one of these elements is tantamount to ensuring that we have a comprehensive approach and that we are ensuring that all of the partners that Tammy just identified for us are in the process and part of managing program integrity. Our first is eligibility verification. Let's make sure that the folks that we're serving are able to participate in the program. Provider compliance, we want to make sure that the providers are meeting the requirements both federally and state so that they can remain using the program and it can continue to grow. Payment accuracy. So we want to ensure that payments that are being made are in the correct amount for the correct services. Fraud detection and prevention. So here was an opportunity to implement measures that identify and prevent fraud activities, informing participants and clients about our program rules. And last is audits and reviews. So conducting audits and reviews that ensure compliance and identify areas for improvement. Next slide, please. So we're going to start off talking through each element. I'm going to do a little quick walkthrough of what you see in front of you. So the column 2, your far left, where it says where New Jersey started, this is where our program began. As I noted, we started back in 2008. And this is the things that carried us to where we are now. So it'll be what we started with, where we are now, and then where are we going? And that's the culmination of where we started, where we are now, and our future. So to begin, when it came to eligibility verification, our participants had to be eligible for Medicaid services. And New Jersey Medicaid verified the Medicaid eligibility for our fee-for-service population. Now we have expanded our program to include our managed care organizations. And with that support, it is their role to verify eligibility for our NJ Family Care members for anyone in their plan accessing self-directed services through our Medicaid program. And last, where we're going. We want to define and implement verification processes that ensure timely eligibility verification on both the health plan and the for our FFS members, so that we can ensure there's no gaps or issues with getting that services to our eligible individuals. Tammy, did you want to share with us from Arkansas?
I do. I just want everyone to keep in mind when you're looking at, where Arkansas started, where we are now, where we're going. When I think back on this is really when it was the birth of self-direction. Some of the things I'm going to outline here. So independent choices participants, they had to be eligible for Medicaid services. Some of the things we struggle with didn't have sufficient reporting to be informed timely of loss of eligibility or even a reinstatement of services where someone lost one and was reinstated to eligibility for Medicaid. Monitoring and oversight of budgets and the utilizations of those budgets were very manual and cumbersome. But again, we got the job done. We were in a demonstration at this point, and then we moved over to the waiver. But where are we now? I look at that and it's exciting. So a couple things. One of them's not on the presentation, but we actually have a new MMIS system and an ARIES system that allows us to see eligibility. So not only my team is able to and are trained to identify eligibility issues, they're able to go in and assist with what the issue is. They can't fix their eligibility, but they can identify and notify. So, so these specialists are technically, when someone is enrolled in the program, we're checking eligibility 3 different times, before, in the middle, and after, so that we can go ahead and enroll that client without them losing their eligibility. And information is communicated to our contractor, our FMS or FI, some of you know them as, and RNs through reporting. And then where are we going today? I love it. Improvements in our current reporting is overall, the processes that we have developed over all these years are highly effective. They're very efficient for program oversight for the verification. Again, I've said we check that initial verification prior to even enrolling. And we also have daily, weekly, monthly reporting that allows us to know when a client has lost eligibility, when their eligibility has been reinstated, so that we can keep them moving forward within the program for their services. Thanks. Next slide.
Okay, so that was the Arkansas slide that Tammy was just speaking to, and now we'll go to the New Jersey slide. Thank you.
Thanks. So now let's talk about provider compliance. And just as a point of clarification, in PPP, providers are referred to as workers, caregivers that provide care for PPP participants. So just letting you know, when we use that word, that's how we're using it interchangeably. So when the program began, the fiscal intermediary, through its information assistance supports, educated and supported our participants with provider compliance requirements. The participants would oversee the provider compliance of their self-hired worker as the individual that is self-directing. they manage that part of of their role. And lastly, providers were were educated, and they needed to adhere to the program rules and requirements. As we moved to adding managed care delivery, we were received the benefit of their support to provide additional knowledge and education to support PPP compliance and its impact on providers. This is a key partnership that has been an opportunity for our program to flourish. And where we're going is we want to continue to work with our MCOs and our fiscal intermediaries that support our members with understanding compliance and its impact to their workers. The focus here is to empower them with the information they need and the resources available so that they can ensure that their payments are appropriate and they meet service utilization based on their service needs. We're also looking to implement reporting and oversight activities for our health plans and fiscal intermediaries, demonstrating compliance with the program rules for workers. So we look forward to building out that element of this part of our strategy. Next slide, please.
Okay, Arkansas provider compliance. So again, where we started, the FI provided management of financial paperwork and budget changes for pay allocation to our clients and providers. The FMS at that time, they still were just supporting us on that financial part, but were not involved in any additional support. So our model looked quite different. The FI provided minimal education and supports. It was really about get those working documents, put together and let's move forward. Program management and support was actually managed in-house with a 7-person counselor team specializing in self-direction. And the FMS self-direction specialists, they would actually oversee the provider and participant for compliance. So we were very busy, needless to say. And self-direction providers we would be required to make sure that they were adhering to the rules and regulations. What we had was a handbook, and we called on the phone, and we would try to communicate this program through the telephone and mail. And so, of course, thank goodness, evolution occurred. And where we are now, the FI provides information and assistance and financial management support for the clients and providers, which I love because prior to this, we were not really allowed to talk to the providers. We could only talk to a client. The partnership that we have between the FI and the self-direction specialist to oversee compliance, we work in tandem with them. And that has been very magical because everyone has to have ownership in making in my opinion, and Arkansas's experience, making this program function at a high level and smooth. We also have QA reports. We monitor the accuracy between our database and the MMIS system to avoid issues. And underutilization report analysis. Where are we going to go? Okay, Arkansas, where are we going? We currently are in the early phases, which we have done, of contracted support outside of the FI, and their sole purpose really is to assist in auditing EVV claims for duplication of services or fraud. Been extremely helpful. Aging, DHS, we educate our contracted supports on self-direction. The FI provides, helps us assist us with program compliance and supporting the providers and assisting and providing webinars for our clients, providers, and our staff. And the FI also assists with the EVV compliance. But again, this is where our partnership still stays in place. We're all responsible. So that's been very, very helpful. And to be honest, having access to our FI's database and having knowledge of what they see and what's going on has been We had never had that before. It has been fantastic. Thank you. New Jersey things. Oh, you're on mute.
Thank you. So let's talk through payment accuracy from New Jersey, where we started. The fiscal intermediary educated and supported the PPP participants with managing payment accuracy for their workers. Workers are asked to submit timesheets to their participant for review and approval, and then members approved their provider timesheets. It was pretty linear process. Where we are now, so we have what we call the New Jersey PPP State Program Office, referred to it as the SPO, and the FI implemented some payment-focused items to assist, specifically adding a payment pending rule that requires timesheets that have been submitted but do not align with the member's approved monthly budget. It's an opportunity to ensure that the participant and their worker are staying within the budget, assuring that the payment is accurate, and it provides that level of education that keeps us moving forward with understanding the importance of payment accuracy, and that lies with the participant and their worker. So where we're going, we have an opportunity to provide better support using our information that is available. So currently we're looking to implement utilization review requirements for our health plans so that they can proactively support their members and their workers with managing their budget and making sure their services fall within their allotted budget. The intention here is to keep payment flowing, ensuring that the work that is being provided falls within the program rules and are appropriate, but it's also an opportunity to ask our health plans to look at data that is currently available to them to support proactive program integrity. They have an opportunity to understand how their members are utilizing the program and where there may be areas for re-education, better understanding, and potentially if there is a service limitation, it gives that focus and an opportunity to address it in real time and slowly can pull back the recoupment process because we're getting in front of the issue in real time. And again, our MCOs are a great partner for assuring this expectation for our participants and their workers, but they're also helping them focus and stay in real time on track. And this is a really big key for using all of our stakeholders following this particular element. Thanks. I'll turn it to Tammy.
Thank you. Okay, Arkansas payment accuracy, where we started. The FI supported self-direction participants with managing payment accuracy for self-hired workers. Participants submitted basically their timesheet to the FMS for payment approval. The FI approved payment on timesheet upon review of the authorized plan of care. Okay, so where are we now? Participants' budgets are monitored by the FMS or FI, as you know them, to ensure provider isn't paid more than the plan of care allows. Budgets are compared to the authorized Medicaid budget. Medicaid reconciliation, we also have Medicaid reconciliation, where DHS monitors the use of Medicaid funds that are dispersed on behalf of the beneficiaries and reporting that's provided to the FI regarding that. We also have a recon process where any unused funds do end up returned back to Medicaid. And I said before, we have the ability to see into the FI system, which again helps us with looking at payment accuracy as well. All right, so where are we going? electronic automation for budgets to eliminate manual entry and keying errors which impact accuracy. Because we are still set up in a way that somebody still has to key the plan of care hours into a system that helps us calculate our formula for payment. So what we are looking at is a potential for that data to be read, uploaded, and eliminate some of that manual work. And of course, always creating more robust QA reporting, utilization, around utilization and other data analytics from both the FI and us internally, DHS. And also, a potential change of payment methodology to better serve and control payment accuracy is a consideration. Next slide.
Got myself off mute that time. So for fraud detection and prevention, I want to share an experience with a case in New Jersey that really helped shine a light on the value and importance of stakeholder buy-in and support of this program. Very quickly, we received from our Medicaid fraud division, they shared a case that had been sent to them for an investigation. And through the information provided in that document, their question to us was, what happened? Why did this occur in your program? So we had an opportunity to take that back and look through it. And part of what we noted here in New Jersey was that there was a lot of gaps and operational challenges with helping and supporting and managing a member. And it became more and more clear how using the RACI matrix to define and understand each piece of fraud detection and prevention, from the point of responsibility, accountability, who is consulted about that, and who is informed. And this is a key part to where we started to where we're going. So where we started, the fiscal intermediary did the majority of the education and support for their program participants so that they understood fraud, waste, and abuse detection and how to prevent it. There was continued re-education for members occurs every quarter. Everyone has to have a face-to-face visit, and through that visit, fraud, waste, and abuse education is again provided. And we also, this program would review instances of fraud and work with the FI to go to work the member, their worker, to attempt to do recoupment for inappropriately paid funds. Where we are now, we've taken the lessons learned from that experience, and now we work with the State Program Office, and MCOs are now reviewing reported cases of fraud. In instances of substantiated fraud, the FI vendor engages with the participant and their worker to recoup the funds. And our MCOs now, through their review, can submit cases to the Special Investigation Unit, referred to as the SIU, for potential submission to Medicaid fraud. So now we have two entities with the support of the FI managing, overseeing, and helping with fraud detection and prevention. So where we're going. So we have these great lessons here. It's time to take it to the next level. So again, as I noted before, this is where implementation of a utilization review requirement for our health plans, again, will be a key element. If, for instance, we have an individual who has been given the information, they know that they're in a hospital, that they need to let us know that they are not able to use PPP. Sometimes that gets lost in the sauce when people are living their lives. So the opportunity for health plans to have access to information around a hospitalization in a more real-time capacity allows immediate response and support, and the ability to not have a long-term inappropriate funding source and provides clarification around expectations. And I do want to add one other thing that we do with our folks that are interested in starting the program. If someone wants to join PPP, they go to their health plan. Each health plan has to complete options counseling. And through that options counseling, there is a very clear verbiage through our documentation about what fraud, waste, and abuse is, how it looks in this program, and potential outcomes if there is fraud detected. So we have made sure that our folks know about it when they're asking about it, when they enroll, and every quarter thereafter. And with the support of our health plans, we have a really strong program to keep this effort moving forward and mitigate long-term experiences of inappropriate utilization, fraud, waste, and abuse. Tammy, would you share with us about Arkansas?
Absolutely. So where Arkansas started. So our DHS, we are self-direction counselors. How we managed this process was basically desk audits, client files. We basically requested timesheets from our FI to review payment disbursements against the authorized budget. We had very, very limited reports. We did establish some that were needed, like the hospitalization, if someone goes into a nursing home. We also at times allowed budget funds to be reduced and put into an account called discretionary funds. I want to remind y'all that this was 20 years ago known as a cash and counsel, but we discovered that was not a good method because unfortunately there were some that were trying to take advantage and it was a little less manageable. So that was our first sign we needed to take a look at how the program was being utilized. And we had to make some changes. And I think that's good. We were able to see that and go, okay, we need to make some changes. Where are we now? We are a partner with OMIG. And we ensure that they understand how self-direction works because I had to go through a lot of myth busting. There was always comments about it's fraud, it's fraud, it's fraud. And what we learned was no, would you please? And what we did was we invited them to a meeting and we walked through every one of the FMS's performance indicator, how that was met, what reporting, how we managed all of that. And of course, quarterly meetings. And once you kind of snuff out that rumor, they're like, oh, okay. So I think everyone's afraid of them, but I think if you show them, we were confident enough to show them. And I also wanted to know if we didn't have things in place we needed. And they actually were like, thank you for clearing this up all these years. So I said, there's something to building that relationship. Quality assurance checks in our data. And we do data analysis for early detection of fraud and misuse of funds. And I know you guys have heard me say that we have reporting. It's built throughout, and we'll talk a little bit more about that. So my workflows are integrated to my data analysis and communications with our FI. And where are we going? We are developing more. It's always about reporting and data now. So we are developing more robust, more streamlined, continuing our existing and current communications with Office of Medicaid Inspector General, more fraud, waste, and abuse webinars with our clients and providers, require fraud prevention video. We talked about a video, but what we're really wanting to do is on the front end, talk about that and have the individual certified, go through examples and maybe a mini test of what is, making sure they understand that's the point of it. And so then we also go through the support brokers also support our clients and our providers knowledge and education on fraud, waste, and abuse. And then also making sure that information is on our FI's website about fraud, waste, and abuse, providing maybe videos and educational pieces. Thank you.
Again, so audits and reviews, how are we approaching this through the audit process and review? So New Jersey began with the state program office and the fiscal intermediary reviewing PPP participant utilization for overpayments, potential fraud, waste, and abuse of program funds. We are audited by the OIG and New Jersey's Office of the State Controller to make sure that we are following along with the program requirements. We add to that, based on those audit findings from these two entities, we had an opportunity to review and implement best practices recommendations to improve program oversight. One of these pieces is a quarterly fraud report that is submitted by each health plan, which gives information about cases that have been referred to them or cases they have referred out. But the intention is to understand the current cases that are experiencing fraud based on review, reporting, referrals. And we work through this process to see how the health plans are managing it. We provide guidance and feedback on next steps. We look at each case based on the merit of that individual. Sometimes it really is a re-education. They forgot, they didn't realize, they get re-educated, funds are recouped, and they are able to continue using the program. We do also use this as an opportunity to manage recidivism around fraud, waste, and abuse, especially if folks are, maybe have an issue with one health plan and over time they move to another health plan and we see that the same fraud, waste, and abuse issue shows up with two health plans. It gives us that holistic point of view of how folks are utilizing the program. And based on our guidance and feedback, we have built a better understanding of expectations where folks have an opportunity to re-educate when it was a genuine error and continue using the program. We also have an approach for folks that are inappropriate based on fraud, recidivism, and a lack of investment or interest in moving forward using the program correctly. What we're going to add to that is this implementation of the utilization review. So if you notice, there's a theme. We're talking through a theme. We have the data to help us manage this process proactively. Most of our experience is reacting. We're always reacting. How about we use our skills, our knowledge, and the education and supports to manage things in real time, use our data to the best of our ability, and mitigate opportunities for potential fraud, waste, and abuse. Tammy, why don't you take it away?
Thanks. Okay, and Arkansas. So where Arkansas started, the DHS nurses, they reviewed all the Planet Cares and the activity while the self-direction counselors handled everything manually through desk audits and paper file pooling, reviews. And they, it was a QA department for auditing of the program. We probably had like 4 nurses. And of course, they're good about documentation. They're pulling through these files, and we, required that anyone's file was also, it was kept accurate with the right documentation. If not, you had to follow up with paperwork. So that was kind of what that model looked like for auditing and reviews. And of course, anyone that needed to be reported to the Inspector General was. What we do now have in Arkansas, we have established reporting for all areas of our program. We have worked years to get here. It also supports, again, I've said this before, our contract PIs, and integrated with workflow. Our reporting and processes, as I said, are integrated. It helps us so much to manage the day in and day out of the program. And it's also really been a big factor in contributing to us being able to find, or detect issues and in real time. And as Becky had stated, for me, the firefighting drove me crazy because I've done it for years. And we just got to a place where we were able to start developing reporting and things that would assist us, because prior to that, as you all know, it was manual, everything. And again, a robust team of auditors. We currently also have a system comparison and analytics, and it's done by DMS, the FMS, our self-direction team, our EVV vendor. And again, you're hearing a common thread, because when I go to the next slide, or next category, it'll make sense. The common thread is this dynamic has shifted to it's all who are involved. For example, you can't just do this without, it's that matrix that we were talking about, the RACI matrix. And it drove me crazy because we would make a decision and the other area wouldn't be notified. And that wasn't a practice. But what we found was that, we have to, who's responsible, know who's accountable, know who you need to consult, know who needs to be informed. And mine goes even deeper, which is everything in Arkansas touches each other. When EVV came along in automation, so you have to think through that so you don't have these gaps in whether it's auditing, whatever it is. So you have to start working with the other people that are involved around EVV and the other programs. So also, where are we going to go? We're going to continue again to develop our reporting as our program changes and grows. Continue to have auditing provided by an outside contractor for EVV. I wanted to really quickly give you all an example of where I found that valuable for that additional contractor for EVV. So in Arkansas and self-direction, we have individuals. They are required to get a Medicaid provider number. And so they go through the process and they become enrolled as a provider / worker for a client. But they also have the ability to go over here and work with an agency provider. Okay. And so the agency provider, basically, they utilize their same number and they're logged under the agency. Well, during this auditing process, what was discovered was, and we realized, oh man, the systems don't talk to each other. So we have our self-direction group, and then we have our EVV and agency group, and she was billing as if she was in both places at the same time, because there was no way for the system to catch that's what was happening when you self-direct. And then there's an agency EVV. So bottom line is, we realized that auditing for that, they were able to find that and hold that person accountable for that. So we really recognized, wow, we would have never thought these need to maybe talk to each other. So it's been a real learning lesson. And part of our, in the future, is making more direct connections to systems with others so that we don't have multiple systems and expenses. So outside of that, I am proactive and don't like to firefight. Next slide.
I got to tell you that firefighting, that analogy really hits the nail on the head.
It really does. So as we move forward, we must recognize that integrity is a shared responsibility. So what does the future look like for PI efforts in self-direction?
So I can share how EVV verification, utilizing our EVV for tracking performance and working with our stakeholders to engage with compliance expectations and working with our participants and workers who are non-compliant. This is an area that in New Jersey we meet with quarterly to talk through with our stakeholders. Additionally, a drop down for Q&A, specifically when someone is adding, using what we would call specialty time submissions. For example, in New Jersey, we have a state sick law for our workers. So we have to make sure that we provide the opportunity to confirm that folks that want to use a specialty time submission, how it's defined, is appropriate and that they are eligible to utilize that option. Tammy, you want to talk us through our last three?
I do. So also increased data analytics. We have the improvements, consistent review. When we talked about the pending rules, 4-time submission. So for us, we don't want our FI paying beyond the plan of care authorization. So that pend rule basically allows them to basically suspend a claim prior to payout, suspend it and review it, and then determine what action comes after that, which I love because we do have some challenges with individuals kind of still learning a little bit about EVV and the claims and the plan of care. But that pen rule has, it's very, very important. And then continued fraud, waste, and abuse tracking and member education, which is critical.
Thank you so much. This was so informative. I know we only have a couple of minutes left. We have some really great questions that came in so far. Anybody who, wants to ask the panelists some questions, feel free to go to the Q&A icon. It should be at the bottom of your screen, and you can type in your questions. There are a lot, so I don't think we'll get through all of them during the live presentation, but let's give it a go. Okay, so I don't think this is a question, it's just more of a statement, but I like it. I'm still going to read it out. So in Missouri, stakeholders have created a virtual community to support each other and new users of SDS. We grew from a group meeting locally once a month to having monthly Zoom meetings available across the state, a website with sample documents, and a biannual conference for users. One of our sessions always addresses alignment with ISP, documentation, and monthly summaries. So love that.
Love
Yeah.
it.
And I think that question came in around the time that you were talking about the amazing advisory council meetings you do with the community members in your states. Okay, we have another question. How long has EVV been in place for self-directed services in your state?
So for New Jersey, we began implementing through a pilot in 2021 with one of our health plans. As we managed that pilot, we completed our full implementation by the end of 2023.
And I don't have the exact date, but it is around 2021. It was, I remember that because it was actually extremely traumatizing for our population. And we were the first to go. So self-direction in Arkansas, we had to try this first before agency providers. So it's around the same time. Yeah.
And just for anybody who may not know, EVV stands for the electronic visit verification. Okay, next question. The education of participants and workers at the beginning of New Jersey's programs seemed quite frequent. It is. Is there still repeated education of participants and workers?
That's a great question. So yes, our participants must participate in 4 quarterly meetings every year. During that quarterly meeting, they meet with their financial consultant and they review programs, they go through their services, and a part of this is a required fraud, waste, and abuse re-education. It's a great opportunity for folks in real time to understand or answer questions around what may constitute that fraud, but it also ensures that they are consistently receiving that re-education. So it's about consistency, thorough support, and communication, and sharing that expectation with our partnerships, specifically our participants and their workers.
Okay. Would you be willing to share your policies and procedures regarding fraud, waste, and abuse if another state reaches out to you?
Sure.
Yes.
States have been so tremendously helpful to New Jersey. It would be my joy to share that
We want to
knowledge and
save you the
experience
pain
with
and
other
help you any
people.
way we can.
Yeah. Yeah. We'd love to hear from you and learn from you. Maybe there's something you're doing in another state that we could benefit from. We're all in this together.
Collaboration. Okay, this one is Tammy. Is the fraud video on your website? If so, can you share the website name and location? I think maybe that's when you were talking about our future goals.
Future state, yes.
Yes.
We'll be more than happy. We have lots of ideas around that as well, not just a video, but really like having them sign something and go through it and then take a little test. So absolutely, but we do not have it yet.
We're building it out, folks. Love this. Okay. I think maybe we could take maybe one more question. I know we're low on time. Would you be willing to share any specific quality assurance checks in your data analysis? I don't know if we can get through that today, but maybe reaching out to the state individually, because I know that they're very extensive.
Yeah, ours are extremely extensive. We have more reports than.
Me too. It's wonderful. Okay. Are individual families audited in your respective states? Can you also give us another example of fraud that may have been discovered?
So from the New Jersey side of things, individual families, I wouldn't say are audited, but there are expectations to review the cash management plan every quarter, understanding how you're assigning your services and the expectation that you follow that program. And it's not necessarily done, family by family. In New Jersey, our 1915J also serves state plan folks. So not everybody's has a waiver specific plan of care related to that review. And just quick examples of fraud. Sometimes there are anomalies in a pay, looking at a timesheet where somebody was able to put in an exceedingly long amount of time. That'll pop up in utilization. Let's look at that. What's going on? Someone was out of the country and didn't mention they were out of the country. You may not use this service out of the country. So in those cases, we find out that they came back from another country, they didn't report it, and they were inappropriately using those funds. So sometimes it's just the day-to-day communication where things pop up, and other times there are clear indications of inappropriate behavior that we see through our utilization review and our partnerships with the fiscal intermediary, the community, and our health plans.
A really common one for Arkansas, and I'll be real short. A really common one for Arkansas is our nurses go out to the homes, but our nurses will let us know, for example, oh, client's in the hospital and here's your, they've been there a long time. Here's your closure date. So we go in there and we always go into the system to see if there's claims pending. That's why I love having access to the FI system, because I can see they have posted claims. So then we're like, okay, guess what? So we kind of collaborate between the FI and ours. We're like, okay, this needs to be reported. They know this. Those are common ones that occur. We just don't seem to have a lot of fraud reporting, but we do have it. But it's not all over the place. I can say that in no way, shape, or form.
Thank you. Inez, you want to close us out?
Yes, thank you all for joining us today. Thank you to our panelists for sharing their expertise and time. A quick survey will pop up on your screen following the webinar, and we'll be hosting a few more sessions for the rest of the month. So remember to register for them individually on the appliedselfdirection.com website. Everyone have a great day, and thank you again.
Thanks, everyone.
Thank you.